Today is World Heart Day. This is a day to bring awareness to heart disease, which is the leading cause of death worldwide.
Yeah, with those statistics, it can be daunting. Many of these deaths are actually preventable, so that's the good news. Minneapolis-based nonprofit is working to bridge the gap in access to life-saving health care for children born with congenital heart disease in underserved countries, places where these critical services are not readily available to everyone. So joining us now is the president of Children's HeartLink, Jackie Boucher. Good morning to you. Thanks for joining us.
Good morning. Thank you so much for having me.
So let's start off with just building on that statistic. So how many children are actually born with heart disease? And how many of them actually have access to the care that they would need?
Yes, definitely. 1.3 million babies are born each year with congenital heart disease, which is an abnormality in the structure of the heart. 90% of those don't have access to either the diagnosis, treatment required for them to survive and thrive. So many will die.
90%.
That is a staggering statistic. When you hear something like that, what goes through your head? That's not unacceptable.
Yeah. What's staggering is that we know how to treat it, right? We're not looking for the cure. It's the lack of access either to the diagnosis or to the treatment or surgery that's required to treat this defect.
And where in the world are these children located?
Yeah, most are in low to middle income countries, so those in underserved parts of the world.
So let me ask you this then. What is Children's HeartLink? What's actually happening to address the global inequity? Because it sounds like it's staggering.
Yeah. Definitely, it is staggering. And so what we're trying to do is work on several different levels. We're trying to develop partnerships locally with hospitals in the countries where we work to help train them so that they can build capacity locally to treat others. And we do that through long-term partnerships. So we partner with organizations like Children's Minnesota, Mayo Clinic. These medical volunteers donate their time over these long-term partnerships to build up the capacity and knowledge within these hospitals where we work so that they can treat the children and also train others in their region so that more children can be helped. We're also advocating globally. You know, there is no global strategy to address this, and so what we're trying to do is call attention to this problem and try to help more children and families affected by congenital heart disease.
Are you surprised there isn't a global strategy? I mean, that's surprising when you said that.
Yeah, there is no global strategy for both screening or treatment. You know, many countries obviously first need to develop in these underserved parts of the world primary care, and so surgical care is typically developed later on, and so that's why access is such a problem in these areas.
So what can we do? I mean, you guys are doing a lot already. Is there anything that we as individuals or communities can do?
Yeah, definitely. I think there's 4 ways that people can help. You can go to childrensheartlink.org, the website. You can sign up for our newsletter to get more information to help build your knowledge on how to help. You can sign a call to action. We're trying to really call attention to global health actors on the need for these patients and families to get the care they need and deserve. We have our global gathering on October 28th at the Mall of America, the JW Marriott.
Okay.
And so people can either volunteer or buy a ticket to attend and learn more. And then obviously donate. We're a nonprofit and that fuels our mission.
I was going to say every little bit helps. Hey, Jackie, thank you so much for joining us this morning. We appreciate your time.
Yeah, thank you so much.